Welcome. I get a lot of questions from my website. So I've asked Barbara, who's part of my team, to do an FAQ session. So Barbara, what's the first question?
Okay, Dr. Sipthorpe. Georgine is asking, I got rhinoplasty 14 months ago. The results are subtle. I wish the tip was a lot more pointed and lifted. Is adding filler to this tip a safe, good option, or should I just leave it?
That's a good question because obviously you've had what they call a medical rhinoplasty, which is a filler to the nose. You do have to be careful where you're placing the injections, but usually the tip is a good place as any to use a filler. And so, yes, it may well improve upon what you've already had. I would tend to go back to the practitioner that did it, certainly. And obviously, he did give you a good result, or she gave you a good result in the first place.
That's very good advice. Sarah wants to know, I've never had Botox before, and my slight concern is that I have some skin allergies, coupled with sensitive skin. I'm also prone to developing keloid scars, so I want to understand the risks, if any, of me having Botox.
Okay. So I've actually had a few patients that have had allergies, and in fact I have treated them with Botox. They haven't been allergic to Botox. Having said that, I think it's a good idea to proceed with caution. So typically I will do a patch test, typically on the arm, somewhere that's not visible, and see whether the Botox itself causes any allergy. The second part of the question regarding keloid scars is equally important. Typically, we're using needles that we call invisible needles. They're very fine. So I would be surprised if you actually did get keloid scars from that. But again, I think I would want to know a little bit more about how those keloid scars occurred and under what circumstances. So I think a little bit more questioning into the nature of those keloid scars and also any past medical history or any medications that Georgina is taking.
Okay. Roy is asking, I think the main problem with my profile is the recessed jaw and chin. Can fillers fix my profile?
Yes, is the simple answer to that. Again, I do quite a bit of work on chin and jawline. Typically, as we get older, we get retrusion of the jaw. It goes backwards, which coupled with loss of support at the angle of the jaw actually gives rise to, in part, to the jowls. So from a profile point of view, you can give fillers here to improve the projection, typically just anterior projection, which will improve the profile. I also find that this is an area where you have to build that projection gradually. So I find from my own experience, there's usually a maximum amount that I would be comfortable using, because as part of that treatment, you are in fact stretching the skin. So typically I would not use more than 0.5 ml in that area. And there's also a difference between female and male if one is going to treat the chin as well.
Yeah, that makes sense. We've been getting a lot of questions on Botox, mainly from women who are thinking about getting Botox for the first time. And what comes up over and over again is, what is baby Botox? We've covered it before, but I think we need to cover it again because we get a lot of questions on this.
Baby Botox really is just another name for using smaller amounts of Botox. In fact, it's the way that I've always approached treatments anyway, which is this less is more style. It's easy to put more Botox in, but you can't take it out once it's in. So from my point of view, it's especially with a new patient, especially someone that's perhaps a little anxious, it would make sense to have baby Botox anyway. But more importantly, by using baby Botox, you're actually going to create a more natural look. You're going to retain some of the animation, so you don't end up with a frozen forehead or elevated eyebrows that make you look ridiculous. So again, a very careful approach, but a very natural result.
Thank you. Well, that's it.
That's it?
They're all great questions.
Okay, so if you have any more questions, please visit my website and sign up at drsib.com.